You have to use the sensory area for S1 is the back of the leg, behind the below the knee, along the UV channel. UV channel goes to the pinky toe. Okay, so using the pinwheel, you follow you draw the line along that UV channel. Okay, so is this below? Same as this.
Yes.
Okay, of course you have to give the instruction and expose the skin. Okay, any question for number 1 through number 5? I think this is the longest way, longest one that to explain. Okay, so next one, number 6. Can you lay on your back, please? Okay, number 6 and number 7 is the same. Okay, can you slide up?
You want us to change it?
Yeah, lumbar. Change sciatic to lumbar. Sorry about that. Number 6 and 7. 6 and 7, change the sciatic to lumbar. Okay. Number 6 and 7 is a same test, but it's a the difference is number 6 is positive straight leg raise test, positive brackets, and positive well straight leg raise test. But the 7 is a negative. That's so. But basically number 6 and number 7, the same test that you have to perform during practical exam. Okay, so. For number 6 and 7, I'm going to demonstrate same time. So, for the number 6 and number 7 question, pretend patient came into your clinic. Patient complained low back pain, radiating pain goes down to the right side of the leg. Okay. So whatever that is, the patient will have a problem on the right side. Okay, so number 6 and 7, this is a passive movement. Okay, so this is how you're gonna do. Okay.
Yeah.
Okay. So this is passive movement. Patient supposed to be relaxed. You're gonna lift the patient's leg up. Okay, so I'm gonna lift your leg up. When you have a pain, let me know. Okay, you don't need to tell me anything. So make sure patient's leg is straight. Okay, so I usually grab patient's ankle and grab patient's knee too, to make sure the knee is straight. Okay, ready? Let me know when you start to feel pain anywhere in the body. Okay, and then gently you lift it up. Do you have any pain? Any pain? Any pain? Any pain? Right here. Okay? So this is straight leg raise test. Okay?
Do you keep the leg always straight? Or you do the
Yeah,
bend
always.
okay?
No,
Oh,
straight.
straight. Okay.
It is straight. Okay? Then for braggers, you have to lower the patient's leg until patient's pain eases up. Okay? So I'm going to bring this down. Let me know when your pain eases up. Okay? And gently you right here. Okay? And then when you reach that level, then you suddenly dorsiflex patient's ankle. Any pain? Yes. Okay?
That's positive.
That's positive, right? But during the test, practical exam, you don't need to tell me which test or name. You don't need to tell me the name of the test.
We need to tell you the degree.
No, you don't need to. You don't need to tell me anything. You just need to instruct the patient. Show me how you perform. You don't need to tell me name of the test. If you want to say it, you better be right. If you're wrong, I will cut out the point. But if you are right, it's fine.
But we don't need to tell you if it's a positive or negative finding?
No, you don't need to tell me. You just need to perform the test and instruct. You have to show me how you're going to instruct the patient. That's all. Okay? So you did the SLR with the progress. So you're going to perform well straight leg raise test. So you're going to, for body mechanism wise, you better stand on opposite side. Same thing. I'm going to lift your leg up. Let me know when you start to feel pain. And lift it up. Any pain? Any pain? Any pain? Any pain? Right. Okay? So look at this. If you do this, then I will cut out the point. Let me know when you start to feel pain. And patient cannot evaluate, right? You have to do gently, slowly lift the patient's leg up. Oh, I forgot something that, I used to be a medical examiner for the insurance. So I went to the clinic to evaluate the patient, but there was orthopedist was there too. So he was asking me whether I want to evaluate the patient with him. So I said, okay, why not? And I was so amazed how he performed. I will show you how he performed. Have a seat. He was doing a reflex test. He was doing this. Can you slide? Oh, okay. He was literally doing this. Ready? Yeah, he was doing this.
Now you're paralyzed.
Don't have reflex. Okay, let me see some. So what?
You need a cortisone shot.
Wow, right?
$300.
Yeah.
Cash.
Yeah, that's how they. So you cannot do that because reflex you have to wait until patients respond. So you have to do it once at a time. Oh, you cannot do this either. I see. I wasn't hitting that hard.
Sustained clonus.
You cannot do that too. But I was seeing this. Still, sometimes I got amazed too by patients on new brilliant idea. Okay, that was a 6 and 7. For 8, I usually so 8 and 9 is the same test. So for 8 and 9, you have to ask the patient to lay on their stomach. Can you lay on your stomach? Okay. So remember, patient have a problem on the right side. Okay. The reason that I made this way, this is a you can use this when you have a patient. When you see the pain musculoskeletal patient, then you can use this format. Okay, that's why I made this format. So for Eli test is this. Okay, patient have a problem on the right side. So here, this side, right? If you want to, you can do both sides. Okay, but we don't have time. So I'm going to do on the pain side. Okay, I'm going to bring this your ankle to this side of a hip. Let me know when you feel any pain. Okay, don't touch here. Okay, don't touch here. Especially no, even men. We never know, you know. We never know. Okay. Ready? Any pain when I do that? Okay, that's Eli or narcos, right? Okay, and then femoral nerve traction test is this way. You can do on, I usually do on this position, but you can do sideline if you want to. And this is how I do. I cup patients relax. Okay. So if he's relaxed, then I can move his leg. Okay. So you lift this leg up to the ceiling. Any pain when I do that? Okay. That's femoral nerve traction test. Now, according to the handout, is this way. Can you lay on your side, this side up? Supposedly, slide up a little bit. Supposedly, according to the handout, is this. Bottom leg. You hold it up. Okay. You're supposed to do this way. Okay, but when you open up your practice, changing patient's position take a long time, especially when they're in pain. So I usually do without changing their position. So doing this versus lay on your stomach. This is the same, right? So that's why I do is this way. Okay, that's a femoral nerve traction test.
You always do on the injured side, you don't do on the other side?
Oh, you can. Oh, it's actually for your benefit, you better to do it both sides. Then you don't need to explain anything. Some patients tell me, literally tell me, oh, if I used to do only painful side, then patient will tell me, oh, that's normal to have the pain. Then I will show the non-painful side. Oh, that's not supposed to pain. Oh, then so usually if you do it non-painful side first, then you don't need to explain anything. Then patient know that when shows up something, they know that's abnormal.
Wait, when you're pulling his leg for Eli, it's
Eli,
you're asking him to give you feedback, or are you saying, oh, is there pain? Is there pain? Is there pain? Like,
oh, you have to ask the patient's feedback.
ask him to stop.
Oh no, you don't need to ask the patient to stop. You just bring the patient heel to all the way up to the hip.
So there's no degree. It's just all the way to the end.
All the way to the end. Yeah, you don't need to. This is not for degree. Only straight leg raise test and well leg is a degree.
Where's the pain supposed to be for this?
Oh, for not class test, anywhere around. It can be here. It can be here. It can be here. It can be here, or it can be inside. That's wherever the pain is. That's the indication for not class. Eli is when I do this, instead of patient tell you where the pain is, patient will hunch up like this.
Oh, that's right.
Okay.
That's Eli. But same, not class, Eli same test. But the positive finding is different. It's not that easy to. Okay. Any question up to number 9? Cross out for number 10.
No, number 10.
Cross out number 10. Can you stand up? Oh, stand. For lumbar, okay, number 11 is a lumbar range of motion test, right? Flexion, there's a flexion, extension, external lateral flexion and rotation. Okay, so for demonstration purpose wise, I'm going to do the lateral flexion and rotation first. Okay, for lateral flexion and rotation, you have to face the patient. There's a different way to do it. You can instruct the patient what to do, or you just show the patient what they need to do. Okay, let's just mimic my movement. Can you do like that? And the other side. Okay, make sure lateral flexion. To the left lateral flexion. versus right. If you only do right lateral flexion, not left, then I will cut out the point. Okay? You have to do both sides. Okay? And rotation is this way. Okay? And also this one, okay, look to me. You have to watch patient's movement. Okay, I've seen this. Can you do this? You're not even looking at it. Then why are you doing the range of motion? And then, so when you do it, you have to watch it. Can you do it like this? Okay, and you have to watch how far the patient can move. Or do it slowly.
Oh.
That if you when patient move this motion fast, that's causing the muscle or low back muscle get spasm up. So I ask the patient to slowly turn their body and the other side. Okay, that's rotation. Okay. For extension and lateral flexion for lumbar, you have to stand next to the patient because you have to see how much that they can move. So next to the patient, just mimic my movement. Can you like do this? Okay. Okay, and back up. And can you move like this? Okay. So you have to watch. He's very flexible. Okay. So you have to watch how patients move because you have to have an idea. You have to get a degree of the patient's how far patient can move. And for practical exam, you have to, after you perform this, you have to tell me what is a normal range of motion is. Okay? So flexion 80 degree, extension 20 to 30, lateral flexion 35, rotation 45 degree. You have to tell me that afterward. Okay? For active hip range of motion. For hip range of motion, you have to ask the patient can you hold the table like this? Okay. If you want to move left side of patient's hip, then you have to stand and grab. Okay. To show the patient, you have to use to move patient left hip. You have to move your right hip, right? Because patient have to mimic your movement. Okay. So. I will do the abduction first, and internal and external. The flexion extension I will do later. Okay? So, can you follow my movement? Can you like do this? That's abduction. Can you do like this? That's adduction. Okay? And then can you bring your toe in like this? That's internal rotation. And you do like this, that's external rotation. Okay? But make sure when you do this, ask the patient to hold something. Ask to hold a table or wall, wherever that is. When patient fall, they might sue you. Okay? So for flexion and extension, I know the flexion for, there are two different flexion on the handout, right? But I will show you both of them, but you don't need to, which hip movement did I show you? Only on the outside. So you don't need to do first part. You don't need to do flexion with the knee flex 120. You don't need, you cross that out. I better cross it out now, so I won't confuse you guys. But there is a two different flexion though. Okay. Okay. For I will show you both of them though. So flexion with knee flex is this way. So ask the patient to grab, hold that. And then you, using this leg, can you raise your knee up like this? Okay. When you bring the patient's hip into flexion, if patient bend their knee, they can actually bring it more. Okay, let's try again. This time, do not bend your knee, straight your knee, and bring your leg up like this. Okay, see, it's less than before, right? This versus this, right? Here it's a lot more than, there's a lot more difference than I do, right? That's the flexion for the hip. Extend is this way. Extension is like do this. Oh no, using this leg. Yeah, when you do this, don't confuse your left and right. Okay, and you do like this. Okay, because of that, it cannot move.
Need to straight the knee.
Yeah, better to straight it. Yeah. Okay, that's the extension. You have to watch the patient's movement. Otherwise, I will cut the point. For active knee, is this. Okay, since we are in this position, using this leg, this is extension for the knee, and this is flexion. Okay, and then internal rotation is same thing as hip.
No more?
You do this and do that. The external rotation, internal rotation. Okay? Which means when you internal rotate for the knee, you're gonna do the internal rotation for the hip. Vice versa. Okay? For SAT syndrome,
You want
This
to
is
do
the
it on
most
the
difficult
what's it
test.
called now? YouTube now, so
can you have a sit here? 27.
that's fine. I can get it.
You got it?
I think I got it.
Before you go
I just
home,
shake a
you
little
better
bit.
try this.
That's fine.
Okay, can you cross your arm like this? Okay. So for this, I think I show you, explained to you before. If you, I'm smaller than he does. He's a little bigger than me, right? So if you grab patient's body like this, then I will cut out the point. If I grab like this, then I will cut out the point. You're not supposed to grab patient's neck. Very uncomfortable, right? That's not nice. So you're supposed to grab patient's upper body. So grab like this. That's a lot better than other one, right? So, and ask the patient to cross their arm like this, and you are grabbing patient's upper arm using your forearm. Okay? So you put your hand on top of patient's upper body, and you cradle your forearm across the patient's upper back, like this. Okay? Then you can move it around. Okay? So, CAMS test, you have to laterally flex and extension, you have to put the lumbar into extension and rotation same time. Then you just, after you lateral flex and rotate, then it becomes extension and rotation on that level. Okay? And then you find, I'm sorry, that will take us one. This is iliac crest. Across the iliac crest, that's L4. So you're a little bit lower than that. You put your fist next to the spinal process. So you press 5 times. 1, 2, any pain? Any pain? Okay. I'm not gonna go into the area whether you are in your exact level. You just show me. But if you, when you do 5 times, if your hand is here, then of course I will cut out the point. It's so obvious you are not on lumbar. Right? Same thing. Grab patient's upper body, laterally flex, and rotate. Anything? 1, 4. Anything? No. That's CAMS for sitting. And then can you stand here? Look down. Yeah, I'm short. So if you want to, you can stand on top of the stool or chair. Can you cross your arm like this?
It's the same task you were
Same
doing.
thing, but you're going to do the same thing in standing position. Same thing, you grab patient's upper back, and lateral flex and rotate. L4, so you put your hand a little bit low. That's L5. One, any pain? Any pain? Four, any pain? And the same thing. Okay? This cam step, I know, because I'm doing it, it looks easy, but try to do this, it's not that easy. So you have to do 4 different tests, 2 at each time. Okay?
But it's on the same side, right? Same side that you
No, no.
did.
Oh yeah, no. Your fist
Yeah.
is on the same side where your hand is.
Okay.
Same side where your hand is. If you grab like this, your fist should be on the right side. It's like this, then your hand should be on the left side of the spinal process. Okay?
So we need to do the test on when the patient is sitting and standing at the same time, and also.
Yeah, you have to perform sitting
And also.
and standing.
Okay. Nice.
Because that's the test.
What if the patient is too tall, then it's not.
So you stand on
Take a picture of the
on the chair.
On the chair.
Yeah, I usually shorter. No, I'm small, so
No, I mean the standing position that is not
Oh,
easy
damn it.
to.
Well, the next page.
Taller
Take a picture.
I know, right.
It's extension. Oh, yeah. Flexion. Use it straight. March it in. Okay. Yeah, whoever takes pictures of this, like, I'll be your best friend.
Okay, for number 15 and 16, the same. Balance test with the Yeoman's test. Okay. Okay, turn around. Okay, for balance test, you have to first you have to stand next to the patient because you have to see how much they can bend forward. Can you bend forward and touch the? Okay, hold on. Slowly bend forward. Wait, hold on. And you stop your movement when you start to feel the pain. Okay? Slowly bend forward. Yes. Okay. Okay. Then you can guess he can move this much. Okay. And then continue back up. And then you're gonna stand behind the patient. Step forward a little bit. Okay. Remember, you're not supposed to stand like this. Then I will count out the point. Right? So you have to stand using your this side of your leg on patient's sacrum. Okay? And you have to grab patient's ASIS, which is here. Okay? Okay. And can you bend forward? Any pain?
Wanna see
Any
it?
pain? Yes. Okay. And back up. Okay, that's a balance test. I'm not gonna ask you whether it's positive or negative. You don't need to tell me anything. You just show me the test. Okay? For the Yeoman, lay on your stomach. Fly up a little bit. Okay, Yeoman's. Can you put your hand like this? Okay, does the patient have a problem on the right side? Okay, Yeoman's is similar to the femoral nerve retraction test, but only difference is you have to, for Yeoman's you have to press ASI and PSIS. Okay, PSIS is here, right? So just like a femoral nerve traction test, you cuff the patient's ankle, knee like this, and you lift it up, and then you find a PSIS. Any pain? Okay, that's your omas. Okay, yeah. If patient is big, not that easy. Okay, that was a bell test with your omas. Okay, next one is Thomas test. Can you lay on your back?
Oh my god, we have to do the whole 3 sheets. Are you kidding me?
Patient have a pain on the right side, right? For Thomas test, if patient has pain on the right side, you have to lift the patient's left knee up. Okay? Can you grab your this knee? Okay? And bring it all the way up to the chest. Okay. Okay. So Thomas test, you are watching this area. Okay, that's pretty normal. Okay, but if when he bring the patient's knee up, then if patient's thigh goes up like this, okay, then it's positive for Thomas. Okay, bring it up. And next one is another difficult test. You are testing on the right side, so you have to bring the for overs test. You have to bring the patient this side up. So lay on your side, this side up. Can you slide toward back and toward the edges? Okay, like this. So supposedly you supposed to use or grab patient's leg with the one hand. Even him, okay, he's a little bigger than I do. Lift his leg up is very difficult. And he's pretty muscular. He has muscle, right?
Oh
so
my
it's
God.
difficult to raise patient's leg up with one hand. So I usually use two hands. Okay. So, this is a for slide. You're supposed to do this way. You hold it, and you have to hold the patient's hip. So you're not supposed to allow patient's hip nor not this way nor that way. So you have to patient's hip, this hip supposed to be on top of the opposite side of the hip. Okay? So you're supposed to do this way. You lift it up and external rotate,
Oh god,
and then you're gonna do this and hold it up.
feels like 2.5 class.
But it's not that easy. So I usually use two hands, and using my body, I stand behind the patient's hip. So if I stand, his hip won't roll over. Okay, I usually stand like this, and I bring the patient, grab patient's knee
I will have to do
and
that
the
again.
ankle at the same time. Okay, just relax. Like so. Relax. External rotate. Okay, and then into the extension,
2.5 class.
and then I grab patient the ankle. So see, this is close, right? If when you ended up grab ankle like this, if his knee is like this, then it's positive. Do you remember the dog peeing on fire hydrant? That's over test, right? So before you go home, try this. This is very difficult test. And Trendelenburg test. Can you stand up? And turn around and look at it. And can you grab this thing? Like that. Okay. For Trendelenburg test, you have to, sorry to touch your hip. You are looking patient's gluteal fold. Okay? So for Trendelenburg test, whichever the patient is standing on, that's the side that you are testing on. Okay? So if patient have a problem on the right side, you have to lift the patient's leg up on the left side. But since we are here, so in this case, patient have a problem on the left side. Okay? So you have to give out the instruction first. Make sure you grab this table and you lift your knee up. This position, like that. Okay? Wait, hold on. Put it down. And patient not supposed lean like this. It is stand straight. Just lift this leg up. Okay? And then you looking at patient's gluteal fold, right? This gluteal fold is this side. Sorry, this touch your hip. This side is higher than this side, right? You see, right? So this is negative for Trendelenburg test. Okay? Can you lay on stomach, please? Why you don't write down? Don't write down yet. Do not write down yet. Can you lay on your stomach? Thank you. Okay, 20 and 21. Patient have a problem on the right side. Okay. Is that okay? So patient have problem on the right side. So hip test is this. Patient's knee on the 90 degree. You're gonna bring the patient's foot outside. Then that's